Okay, so we're continuing on with the forearm and the hand. Right now we're going to discuss walking on your hands. It's trail number 4, okay? There are 8 carpals in the wrist. There are 2 rows, a distal row and a proximal row. We're going to start out with the pisiform. So you're going to have your partner supinate. The pisiform is located just below your 5th metacarpal. You can feel a little pea-sized bone that you'll be able to slide medially and laterally if you use your forefinger and your thumb. It's actually encased, it's a sesamoid bone, it's encased in the flexor carpi ulnaris, okay? So next we're going to palpate the triquetrium. So if you palpate the ulnar, the shaft of the ulna, down to the ulnar styloid and go just into the wrist crease, very, very gently, a very light palpation. If you do ulnar deviation and radial deviation, when you do ulnar deviation, the triquetrium kind of slips into the wrist. If you do radial deviation, the triquetrium will just barely pop out, okay? Next, we're going to talk about the hamate. If you go distal to the triquetrium and the pisiform, you'll be able to palpate the hamate. The hamate is a larger carpal bone and it articulates with the 5th metacarpal, okay? If you just barely palpate a little bit harder than you were palpating the triquetrium and the pisiform, you'll be able to find the hook of the hamate. Oftentimes it's a little bit tender, so your partner can let you know right when you palpate it, okay? Next, we're going to talk about the scaphoid. The scaphoid is the most commonly fractured carpal in the wrist. Oftentimes with a fracture, patients can be diagnosed with avascular necrosis because there's not very much circulation to the scaphoid. The scaphoid is located in the anatomical snuff box. So if you ask your patient to extend their thumb, you can see these 2 tendons. You're going to gently palpate right into that anatomical snuff box. And as you radially deviate, the scaphoid sinks down. As you ulnarly deviate, the scaphoid should pop up right under your fingers. Okay? The scaphoid can also be called the navicular. Next, we're going to talk about the trapezium. The trapezium is just distal to the scaphoid. The trapezium articulates with the 1st metacarpal to form your CMC joint, your carpometacarpal joint. So one of the things you can do is have your partner flex or extend and flex their thumb. Good. To just see where most of that movement occurs. Okay? Next, we're going to talk about the lunate and the capitate. The capitate is the largest carpal bone, okay? You're going to locate these by going from the radial styloid onto Listler's tubercle, okay? Once you find Listler's tubercle, you're going to just go distal and then slightly medial, and you should run your finger right over the lunate. The lunate is the most commonly dislocated carpal in the wrist. So just distal to the lunate is the capitate. So most of the time, if you flex your wrist, you can see mine just a little bit. Right there is Dr. H's. So when they're in flexion, you should be able to palpate it a little bit easier. So that's your capitate. Just distal to Listler's tubercle, distal to your lunate, and it articulates with your 3rd metacarpal. So that's another way to find it. If you just palpate down your 3rd metacarpal. No?
Yep.
Okay, great. Okay, next we're going to go over our MCP joints, our metacarpal phalangeal joints, okay? So these are our knuckles. So you're going to just kind of flex and extend your partner's phalanges. You can palpate anterior and posterior, also medial and lateral. Typically when you're doing joint mobilizations on on your CMP joints, your MCP joints, it's important to be able to stabilize your proximal phalanx as well as your metacarpal, okay? So you have 4 MCP joints. Next we're going to talk about your PIP joints, your proximal interphalangeal joints, okay? So palpate them the same way that we just did for your MCP joints. Passively practice extending and flexing the fingers. You're going to do the same thing for their DIP joints, distal interphalangeal joints, okay? Your DIP, your PIP, your MCP, and then your CMC, okay?